One of the challenges within the health system in places like Kenya in Africa is the fact that we don't have enough doctors, and access to health workers is actually quite limited.
A patient who shows up at a clinic will have to wait for hours and hours and hours in order to see a physician whose time is incredibly spare, and they might not get the advice that they needed. My dream in Goodlife actually was born out of my public health work across Africa, where I saw that most of the problems that most people face actually are dealt with at the pharmacy. Driving through Kenya, I saw that every single pharmacy was independently owned and operated. And that didn't make any sense to me because I could see that there were global brands that were coming in, but not retail pharmacy chains.
The opportunity for health investment in Africa is immense. It's a $50 billion market within the private sector. This is a market that is growing at 6%. This is a market where the emerging consumer has increasing incomes. And so when we looked at Goodlife, we saw a business that is focused on quality, that is building a platform for healthcare delivery, that was led by individuals who believed fundamentally in the concept of increasing access to healthcare across Africa.
We realized that in this market, 46% of all people seeking medical advice will go to the pharmacy.
Most pharmacies don't have enough drugs, give out the wrong drugs, or give out sugar pills. The dream for Goodlife is for us to be really the first port of call for all primary healthcare that every East African consumer has. So we really want to have these lifelong relationships with these consumers.
Today it is a pharmacy, a wellness outlet. It is a place where you can consult. And so it's an innovative platform that is focused on how do I bring healthcare to the consumer instead of that consumer having to go to what traditionally was a hospital or a clinic.
One thing that I like about Goodlife is the fact that the staff, especially the pharmacists, are very knowledgeable. They will educate me about certain medication. For me, it's a trusted brand.
My young baby was very sick. She coughed at night, so I really struggled getting medication. I tried looking for it everywhere. I really found that it was not available until I walked into Goodlife pharmacies and they offered me quality services. And I walked out of there a happy mother whose kid was gonna get good health.
So Goodlife recently got an accreditation from the Kenya Pharmaceuticals and Poisons Board. That's a gold standard accreditation. What that says is that they stand behind the quality of their medications that they offer in every single pharmacy across the country.
They've got excellent storage practices, they've got trained personnel, they've got a very good layout, they've got consultation rooms. It serves as a gold standard as to how a pharmacy should run.
We want to lower the barriers so that we can deliver world-class medicines and really a world-class experience at the lowest cost ultimately possible. I have known about Leapfrog's investments for years, and I always thought to myself, wow, that is the perfect partner for our business because there's total alignment between the vision, what we want to achieve, and also what we want to achieve for our shareholders. And when Felix first took over the health portfolio, I reached out to him and said, have I got a business for you? And he said, don't worry, I already know about your business and I already know what an incredible opportunity this is.
We are fundamentally focused on building value through operations. And in emerging markets, that's the key, helping and partnering with our investees to be able to create operational value. We believe that you actually create more value when not only focusing on the financial, but also focusing on the social side as well. Purpose-driven businesses are always better businesses. We believe we'll actually grow the Goodlife brand to over 100 locations in the next 5 years.
There's actually something much broader that Leapfrog brings, which are the collaborative relationships that we need with diagnostic services, with supply chain in order to optimize everything that we deliver to the consumer.
In terms of provision of access to care, in terms of making sure that there's quality medications in the market, in terms of affordability. To us, that is exciting, and that is the story of healthcare investment for us in Africa.